Hey there, we're going to cover shoulders today, and obviously a lot of different things that the laser can help with in a shoulder, and those are all going to require slightly different settings on your equipment, so we'll talk through some of those considerations that you'll need to make when addressing someone's shoulder. So as we know, you can have a variety of different things. You can have bursitis, tendinitises, you can have cuff issues that run into the shoulder blade, capsulitis that you try to treat around the entire circumference of the shoulder joint. So you really have to be specific on what you're trying to address when you're setting the machine up to help you with treating a shoulder. So let's take the example of a bicep tendinosis. We know that tissue is very superficial and it's relatively small in the grand scheme of things with the shoulder. Therefore, the area you're going to have to treat would be very small. If this sort of claw grip is 100 centimeters squared and you're trying to address the biceps tendon and even into the biceps muscle belly, the area would probably be roughly maybe 100 centimeters squared. So the treatment for that would not take long. So let's take a look at what that would be for that example, just to give you a flavor. If you go to your perfect protocol and put in 100 centimeters squared for your area, the next box is going to ask you for the power you want to use. You have a lot of options, but anywhere between 6 to even 15 watts of power would be fine. The level of acuity might dictate how high you'd want to go, and on your first treatment you probably want to be a little more conservative. So let's put in 6 watts of power for the first treatment, and dose, again, you're probably going to be in the ballpark of 6 joules per centimeter squared for an acute problem, up towards maybe 10 for something more chronic. So let's shoot for right in the middle there, 8 joules per centimeter squared, and then hit calculate. So to deliver just a little over 800 joules, that treatment, how we set it up, would take about 2 minutes and 14 seconds. And I think on this application, because you're dealing with soft tissue, using the contact of the large massage ball would be recommended. You would put your safety glasses on. I'm not going to treat this actually right now, but you're just going to go back and forth across the biceps tendon. You might want to have them open up their hand just to expose that ideally. And you're going to treat into the biceps tendon in a crosshatch fashion, going 1 to 2 centimeters a second, and just trying to basically cover all of that aspect of the biceps tendon and into the proximal muscle belly. So that's a relatively small area. Let's say in the case of an adhesive capsulitis, now you're trying to address a much larger area. Treatment setup for that is going to be different because you have a lot more area to cover. So if you think in terms of the anterior shoulder, the anterior aspect, posterior aspect, and under the axilla, now you're talking in this case for a medium build female, probably 400 centimeters squared. So in that case, just to give you a sense of how the treatment times would change, now we're putting in 400 centimeters squared. Power, now we're trying to reach a much deeper tissue. So since we're trying to get to the capsule as opposed to that more superficial bicep tendon, we're probably going to try to use our full, in this case 15 watts on our FXI. So for power, we're going to put in 15. And for dose for the shoulder, you're going to be in the ballpark of 10 to 13 joules per centimeter squared to start. So let's start with 10 and hit calculate. So because we're using more energy over a bigger area, this treatment's going to take just about 4.5 minutes to do, and it's going to be delivering just over 4,000 joules of energy. So more energy, more time to create the correct dose over a bigger area. So you can just get a sense of, depending on the tissue you're trying to address, it will change both the power choices you're using based on depth you're trying to reach, as well as the time it's going to take to treat a bigger area. So the higher power will help keep that lower. If you were going to try to address any kind of rotator cuff pathology, you're going to have to bring in the muscles of the scapula. So again, you're going to factor that area in 100, 200, possibly 300 centimeters squared just to get the back of the shoulder. And then if you wanted to come into the rotator cuff distal attachment, you're going to have to add that area as well. It's always wise, if you can, to try to position the shoulder in a position that exposes that tendon so that when you're treating that, you'll get as much light as possible, because you have to respect the fact that the acromion is going to be trying to block that light getting down to the tendon. So just try to move that arm without it being painful for the patient is ideal. When you're getting into the posterior shoulder, the massage ball works great because you can compress and get into all those muscle bellies very nicely and easily. When you're treating the axilla, for men especially that have hair, that can get hot very quickly, and that's also a very sensitive area. So you may change the treatment head to one of our off-contact heads that allow you to move a little bit quicker, and you probably want to reduce your power just a little bit if that's an issue where you think that's going to get hot. If you were treating someone that you were going to be doing multiple treatments for over a period of time, you might even ask them to shave that hair because it'll make it much easier for you to address that inferior aspect of your capsule. So in review, when treating a shoulder, if it's a chronic problem, you're going to use slightly higher power and higher dose. And if it's a post-surgical patient or someone that has acute inflammation, you're going to use lower power and lower dose. Those ranges are going to roughly be 10 to 15 joules per centimeter squared for the more chronic and deeper problems. So when you're trying to address inflammation in the joint space or the capsule itself, you'd want to use that higher power. You can range anywhere from 10 to 25 watts of power depending on what machine you're using and what you have at your disposal. Again, for deeper problems and more chronic problems, the higher power will help with impacting those tissues easier and possibly blocking pain quicker in that one treatment that you're doing. For post-surgical patients, 7 to 10 joules per centimeter squared is recommended. It's more conservative. You're trying to minimize any type of rebound pain from the treatment, and you want to get a good feel for how the patient responds to that before you go into higher dosing and higher powers. Power for the post-surgical patient is going to be in the 7 to 10 watt range. As they start moving better, inflammation comes down, pain numbers come down. If you wanted to increase the power and dose on that, that would be appropriate at that time. Other than that, hopefully that helps, and hopefully you'll be a pro at treating the shoulder after watching this.